Realtor with Keller Williams, and today I'm here at Milford Dental Excellence with the excellent dentists. We have Dr. Gillespie, Dr. Reinick, and Dr. Powers. So thank you so much for having me.
Thank you for coming on in.
Yeah, so let me ask Dr. Powers, tell me a little bit about yourself and how you got started in dentistry.
Yeah, so I was born and raised here in Milford.
That's awesome.
Been a patient of this practice since I was 3 years old. Our senior partner, who's now retired, was my dentist my whole life.
That's amazing.
Yeah, super blessed to have had that upbringing. As far as my career, just graduated dental school in 2014.
Nice.
My husband and I knew we wanted to be back at home where our families were, and so it just worked out perfectly.
That's great. That's awesome. Okay, so Dr. Reinick, tell me a little bit about yourself and how you got started in dentistry.
All right. Well, I grew up in northern Ohio, and my dentist was my father.
Oh, that's
so
awesome.
I was exposed to it through that. And then I also have an older brother that decided to become a dentist. So it's kind of always
dentistry in the family.
Always around it. Spent time in my dad's office. Thought it would be a neat profession.
I love it.
Looking back, it's kind of a cool blend between like the science that I like, and then also the artistry part of being a dentist. So that's what kind of drew me to be a dentist.
That's wonderful. So Dr. Gillespie, tell me a little bit about yourself and how you got started.
Yeah, so I, like Dr. Powers, grew up here in the Milford area. Was lucky enough to shadow Dr. Reinick and Dr. Egbert before applying to dental school.
Oh, nice.
So kind of got some exposure through that and was able to practice for 5 years in Columbus, and we just moved back to the area again to get closer to family.
That's wonderful.
Growing family. So yeah, it's been great. Love everything about it. I love the problem solving aspect of it.
Yeah.
I'd say.
That's awesome. Good for you. So Dr. Reinick, tell me what types of services you provide here.
Great. Yeah, so we're a general dentist office. We see lots of families.
Okay.
So the regular general dentistry as far as fillings, crowns, and things like that. But some of the things that maybe separate us from other offices are that we do Invisalign, so we do a lot of orthodontics through Invisalign.
Okay.
We also replace teeth with dental implants,
Okay.
along with the other surgeries that go along with that. We do some sleep dentistry, which I think we'll talk about a little bit later.
Yeah.
And basically your regular dental cleanings and things like that we provide to families.
Okay, awesome. So Dr. Gillespie, what ages of patients do you see?
We see all age ranges, basically family style dentistry.
Okay.
So parents, grandparents, that's actually how I got introduced to the practice. Was my grandmother was a patient here. So
Oh, wonderful.
kids, adults, the full gamut. We love seeing all age ranges and all.
Okay.
People, yeah.
And just curious, what age would you recommend a patient start coming to the dentist?
As soon as teeth start to come in, I think is the general recommendation. Now, whether we're doing the full gambit of a cleaning or anything like that, no.
Okay.
But just having eyes on them, getting them accustomed to the office, introducing them to there's different people.
Yeah.
Gloves on, what are we seeing here? So
Yeah.
I think it's just good exposure for younger kids to see.
Yeah, for
and
sure.
And then the experience should follow later.
Exactly. Yeah, I agree with you wholeheartedly because I have 3 boys and I know, taking them to the dentist, they love it. Lucky for me, but I know, there's some kids that are a little bit scared of the dentist. So the earlier I think you can introduce them, the better.
Absolutely.
So Dr. Powers, can you tell me a little bit about what makes Milford Dental Excellence so much different than other dentistry practices?
Sure. So MDE has been in our community for just short of 50 years. Our senior partner established the practice back in the late 1970s. So we have had a good hand in the community for a long while.
Yeah.
We are established and we are constantly learning and engaging with the community. Something else that makes us stand out is our amazing team that we have.
Okay.
Our team is top notch. They will make you feel like you are family right from the jump.
Yeah.
And they just produce great dentistry. They are our awesome quarterbacks, and we totally appreciate our team, and you will too. They are phenomenal people, and that is something that is hard to find in a dental practice.
Agreed.
Also, we do a lot of community outreach programs that maybe some other dental offices might not have time to do.
Yeah.
But because there's 3 of us, we find a lot of time to reach out to our community, give back to the people that have made us such a long-standing pillar in the community.
That's wonderful. That's great. Awesome. So Dr. Gillespie, what kinds of things can you do here to make someone feel comfortable that might be uneasy about going to the dentist?
Yeah, of course. I think that uneasiness at the dentist is way more common, first off, than a lot of people realize. I think that's dental anxiety in general either stems from something. And I think that we do a really good job of asking the question of why. You know, what's going on? What can we do to help you? And so that starts with, do you need a hand to hold? Do you need us to do something extra for you? We have headphones, we have glasses, whatever the case may be. Now those patients that kind of transition into needing maybe something else, we have nitrous. We do a little bit of oral sedation where they can take a sedative before they come, and we can treat them there as well.
Okay.
So we really do a good job of addressing the why, I
Okay.
think, across all barriers of care.
That's wonderful.
And I think that that really boils down to what's going on.
Yeah.
We just care at a different level, I think, than other places.
That's wonderful. I love that.
Earlier today, had a patient that was very uneasy. We had an assistant that just was there to hold her hand for an hour.
Oh, wow.
That's all she did.
That's wonderful.
So that's what makes us different.
That's awesome. I love to hear that, because I know that that's a big reason why people don't see the dentist, because they have somewhat of a fear, whatever reason that may be. But it's good to know that you guys are there for them in any way that they need.
And we've had patients that have told us time and time again that we are doctors that specialize in the anxious patient.
Yeah, that's wonderful. So, Dr. Reinig, I heard that you help with breathing and sleeping disorders. Can you tell us a little bit about that?
Absolutely. So one of the first signs that show up for someone that isn't sleeping well, whether it's snoring or whether it's sleep apnea, is wear on the teeth. So they will really just grind the enamel off their teeth. So that's like one of the warning signs that possibly there could be a breathing issue going on. There's also other medical things that may show up on their medical history, whether it's like acid reflux, otherwise known as GERD, sometimes just high blood pressure, especially if it's a patient that's younger that maybe shouldn't have high blood pressure. So an assortment of other medical things that we look at too that might be an indicator that poor sleep is going on. Also, people will see their dentist a lot of times more often than their health practitioner, their doctor. So we feel it's a good service to be able to screen for that, because not only are they wearing their teeth down, breaking teeth, but it could have huge implications on their general health, making them at higher risk for like a heart attack, or just general health issues from not getting enough oxygen. So one of the things we do in our office, just when you're coming in for your cleaning visit, we're seeing some of these things. There's a questionnaire that the patient fills out. Takes like 5 or 10 minutes. And it's a risk assessment, and if it's showing up that that patient may be at high risk for a sleeping issue, we have a take-home sleep machine that basically they would sleep with, and then it measures their blood oxygen while they're sleeping. So you just check it out of our office, just like you go into a library, like a library book. And from there, it gives, it tallies up all the information. We send that to a sleep physician, who basically would diagnose whether it's just more of a snoring issue for the patient, or if it's a more severe sleep apnea issue for the patient. And depending where the patient falls, there's dental appliances that can help, whether it's snoring or mild or moderate sleep apnea, or if it's something more severe where the patient needs to get on the CPAP. But it can have such a huge impact on that patient's general health. So we feel it's a great service to provide our patients.
That's wonderful. Awesome. So Dr. Powers, what is the easiest way for someone to make an appointment with your team?
So we're on all platforms of social media. So you can reach out on Facebook or Instagram. We answer those 24/7. And there's also a portal on our website that you can click onto to make a new appointment as well there. And just give us a call. Some of our most amazing team members are at our front desk team, and they would love to help you and get you scheduled for the appropriate appointment.
Awesome. Perfect. Well, thank you so much, Dr. Gillespie, Dr. Reinig, and Dr. Powers for meeting with me. It was such a pleasure. And thank you so much for watching the Milford Minute. Again, I'm Kristen Manning with Keller Williams. If you are in need of dental services, or if you're thinking of, you know, you might have a sleep disorder or things like that, they're here. They can help you with all kinds of things. So make an appointment with them. Like she said, they're on all kinds of social media. You can reach out by Facebook, Instagram, their website, or pick up the phone and call. Thanks again, and thanks for watching.
Bye.
Bye.